I've talked before that I've had a few patients who actually have told me that they're out of hope, and a couple of them have actually said they were considering suicide because of the chronic pain that they had no hope for. We're not out here to persuade patients or doctors as to what we found. What we found is factual, and the facts are now analytically available, statistically studied in a scientific form that's readable, and it's not fiction. So if you have that information available to you, then both the patient and the doctor should not fear, because what we fear is what is unknown. I can think of 1,000 examples. One close to my heart, because I'm an aviator and been an aviator for 46 years. A lot of people fear flying in a general aviation aircraft, small aircraft, single engine, multi-engine aircraft, not an airliner. Anything other than a 150-seat airliner is a small aircraft to most people. And of course, I've been flying them for 46 years. And I don't fear them because I know not only how the aircraft operates and how the engine works, but I know all about the weather involved in flying an aircraft, and how to communicate with air traffic control, and all about navigation, which now is much simplified with GPS. And I'm not fearful of general aviation aircraft, but I have passengers at times that are very fearful, and I've seen that. And why are they fearful? Because they don't have my knowledge. If they had my knowledge about general aviation aircraft, they would not be fearful. Same thing applies to TMD. If you actually have the knowledge, then you are not going to have fear about treatment or fear about what's going on. That is why a good practitioner, if he's a smart practitioner, it isn't just saying, well, this is what I'm going to do for you, whether it be a surgical event or a pharmaceutical recommendation or a physical effect. It really needs to go well beyond that. A good practitioner, provider, should explain why he's doing what he does and how it works. If you can't explain why you're doing what you're doing and how it works, you shouldn't be doing it, frankly, whether it be surgical or non-surgical.